what are those things that we do have control over in terms of delaying the progression of this disease, or in some cases as caregivers ourselves, right, who do have that increased risk, heritable or behavioral risk. And, maybe in this moment, it's actually just menopausal symptoms that we're experiencing.
Mm-hmm.
We do also still have a long term that increased risk. What can we do now, right? Or yesterday, what can we do to prevent onset even, right? And those 14 modifiable risk factors prevent, like, if you address those robustly, aggressively, it prevents or delays the progression of 40% of all disease, of all dementia. So it's really substantial, the effect. And what we found in our communities, which we try to focus on the people who are disproportionately impacted. So often that tends to be people who are lower income and from communities of color. It's that the advice that's given, and when we're just talking about that mind diet, right, which is a Mediterranean diet, it's not really adapted to the actual foods that we eat. Um, so while I can say, like, these are the things we should eat, it's more powerful to say, like, within my heritage foods, what are those dark leafy greens that we actually eat, right? I mean, like, those would be in Korean food, perilla leaves, which many people do not eat, right? In
Right.
maybe Southern food, right? Like, it could be collard greens, right? For some, it might be spinach. So it's different. And for people to give you a little bit more direction, I think that is more tailored, is helpful, because otherwise you're like, oh, yes, of course, I know I should eat a Mediterranean diet. And who eats a Mediterranean diet apart from people who live in the Mediterranean?
Right,
or
right.
or those of us who have decided we're going to have to just totally transform what we eat ordinarily because we want to be attentive to our brain health. And I'm like, that's not fair. Like, we should be able to make adaptations to what we do eat to maximize our ability to protect our brains.